Good afternoon, everyone. It's just about 2 o'clock, so we'll make a start. Hopefully, you can all hear me. We're really pleased today to be doing a specific SSAT update relating to students with SEND and special schools. My name is Tom Middlehurst. I'm Head of Policy and Public Affairs at SSAT, and I'm delighted to be joined by Pauline Holbrook, who leads on our work on special schools and SEND. Pauline, are you there?
I am. Welcome, everybody, and hi.
Hi there.
And we're really pleased that this afternoon, Graham Quinn, who is the Executive Head Teacher of the new Bridge Group, a multi-academy trust, which incorporates various different schools that cater for students with different needs, joining us as well. Graham, I'm going to pass straight over to you. What I will say is we have a few questions that have come in from the network, which myself, Pauline, or my colleague Mike from SSAT will ask. But please, if I can encourage people on the chat to use the chat function to ask questions, or indeed to raise your hand, and then we'll know that you want to come in and ask the question directly to either Graham or Pauline. That would be great. So, Graham, if you could sort of introduce yourself and your context and just talk a little bit about kind of what you've been doing over the past 7 weeks and the key concerns that you have as a leader of several special schools. Over to you, Graham.
Thanks, Tom. Good afternoon, colleagues. This is quite a strange way of meeting you all. So I'll do my best to try and make it reasonably interactive if possible. And I'm sitting here not as any sort of guru, but just probably in a very similar position to you guys of trying to make sense of the myriad of information that we've been getting over the last few months and particularly the last few weeks or so. So I guess what I'd like to start with really is a position about me, and then I'll go into where our schools are up to. Just really quickly, I'm the CEO of Newbridge Multi-Academy Trust. We've got 9 schools in and around Oldham and Thames side. We've also got post-19 organisation. I'm the SSAT SEND champion, and I'm also on the National SEND reference group that was formed about a month or so ago. So do some work directly with the officials and with ministers. Now, what I'm here today really is as the CEO and as a leader of some of our schools, and to give you an insight into where our schools are up to, how we're approaching some of the challenges, and hopefully you'll get some ideas as to maybe a different way of doing things, and you may also want to challenge some of the ways that we're doing it, and that's absolutely fine. This is our solution for our schools in the Northwest. So if I may start with sort of giving you where we're up to from the guidance that came out last weekend, just so that we're really clear and we're all on the same page. I think it's fair to say that the reaction via the media to special school opening has been a little bit, it's pretty nil really. All of the coverage is about mainstream schools and where we are with reception year 1 and year 6, and how on the 1st of June there will be a number of children in those year groups that are expected to return. I think you'll all be aware that obviously the guidance that relates to our schools, to special schools, is very different. And I think it's really important to say that the guidance in many ways supports a very cautious approach to the reopening of our schools. And the SEND reference group tried desperately to ensure that was there. We didn't want any fixed timelines. We didn't want a fixed agenda that was determined by another party. But actually what we tried to do was ensure that local people, leading local schools, would be in a position to determine exactly what was right for their stakeholders, for the children, for the families, and for all the people that work in those schools. So at this point in time, there isn't a specific opening date for special schools. There isn't a specific percentage of children that we need to admit in any particular time frame. And it's really up to us to do a significant piece of work now to understand what's best for our context. Most of us have been open since the start of the pandemic for groups of children. Nationally, it's still very, very low. The most I've heard is that some special schools across the country have about 7 or 8% of their populations in. I think the rule of thumb, Pauline, is about 3 to 4%. That seems to be maybe even lower than that at times. So
yeah, it varies from school to school, Graham. You're right there, but nothing more than about 4%.
Yeah, so it's still very, very small. And it's for the groups of children, those who've got the families are key workers, and those who we perceive as being particularly vulnerable via their home setting. So that's where we are at the minute. And I'll just pause for 2 seconds just to see if anybody's got any comments or questions that relates to making sure that we're all on the same page in relation to where the guidance tells us to be at this point in time. And then I'll sort of move into where I think we are as an organisation, some of our schools are at.
Great, thanks, Graham. Yeah, any specific questions about the guidance, or indeed if what Graham and Pauline said is not your own experience, and actually you've got either significantly higher numbers or significantly smaller numbers? Just give people a moment to either raise their hand, which you should be able to find in the chat function, or indeed just ask a question via the chat. Graham, I think we're probably good to move on. If you do have any questions, please do put it in the chat and we can go back to those later. But Graham, I think we're good to go for now. Thank you.
Okay, great. Thank you. Okay, so it's sort of how we're approaching the opening of our schools. One of the things that we tried to make clear to government was I think that we're all in a stage where we need to define schools in a very, very different way. And in a way, we're looking at what we're calling a new schooling phase, because I think schools are now operating in a very, very, very different environment. And one of the points that we tried to put across is that for our children particularly, many of them, the ones that are engaged in virtual learning, are still involved in high quality learning, and our staff teams are working very, very well remotely with them. And actually, what we're hearing from across the country is the children that are going into the sites, into the schools, aren't getting a particularly good deal, because I think that there's been this conflict between whether the schools that are open now for the children that we mentioned before are actually performing the function of educating children, or actually we're just childminding children. And I think that one of our anxieties is actually all we're doing is childminding children, really on the fact that because we're not controlling the cohorts that are coming in, we've got children from all different age groups with different abilities who approach learning in a very, very different way. So with the best will in the world, with the staff teams that we've got available at this point in time, it can't be construed as high quality learning. Now, what we're trying to lobby is to actually understand that we all collectively over the next period of time need to move to a model that's called new schooling, and actually determine what that is. So I'll explain what new schooling is later on for us, but I don't know if anybody's got any observations that relates to this idea that actually there's still some ambiguity around the idea, are we caring for children or are we educating children?
Would anyone like to come in there and share a thought about the balance between being caring for children and educating students? I know it's Friday afternoon, but please don't be shy.
Okay, I'll carry on. No problem.
Kevin Morgan said, yeah, absolutely. At the moment, it feels like the emphasis is around childcare and childminding. Yeah.
Okay. Yeah. Okay. Great.
Yeah.
So we're adopting. Our schools are adopting a particularly cautious approach around the idea of opening up our sites. So what we're looking to do is a piece of work around involving as many people as possible in what we're calling our new schooling agenda. So for the next period of time, all of our schools will be involved in this new schooling agenda. And like I said, I'll explain what that is later on. But what we felt it was really, really important to do was carry out and co-construct with all of our partners a process that involves risk assessments, etc., that they absolutely are involved in. So what we didn't want to do was develop risk assessments relating to buildings or to children or to transport, etc., and many other organisations, families feeling that the schools were actually doing it to them. So we're trying to use a co-production type model where for the next 2 weeks, we're just consulting about the process that we will go through before we start to move into our new schooling phase. And we felt that we've had not a lot of battles, because I think generally our local authority colleagues have been really, really supportive, but we're still fielding quite a number of phone calls, particularly from colleagues from social care, who've maybe interpreted the guidance about children returning to school in a different way than we have. So to avoid the muddle that we got at the beginning of the process, where there was the significant challenge between EHCP and vulnerable, and we know that caused massive noise in the system, what we felt it was important to do was just step back and just take breath and actually be in a position where we can now start to really co-produce what the next new schooling agenda will start to look like. So I'm going to talk a little bit now about the processes that we're going through and what we are presently consulting upon. Is that okay? Yeah. Everyone's really, really quiet this afternoon. I'll have to say something really controversial in a second or two. Okay, so bearing in mind the cautious approach that we're taking, we took a view that nobody's going to be in a position to actually argue against a very, very clear principle, which is at this point in time, the principle that we're working to is ensuring that every single one of our children and every member of staff is kept as safe as we possibly can do. So everything that we do defaults back to that single principle. And that we were in a position where actually, as a multi-academy trust, it's going to be our trustees that determine the timelines that we're going to work within at this point in time. Now, the other thing that we've decided is that our schools will work within a single framework, but they will work at their own pace. So what's right for one of our SEMH schools probably is very different to what's right for one of our schools that supports children with profound and multiple learning difficulties. So I'll come into some of the differences later on, but what we didn't want to do is have a catch-all position that says everybody has to work to actually this sort of parameter and these sorts of timelines. So in line with what the government and the unions are doing, we've set out 5 tests. I think have we got, Mike, have we got those up, the tests? I think we might have a screenshot of them.
Yeah, they're going to be uploaded now into the chat area if everybody wants to click on the document. Okay.
So the one thing that we're really, really keen to do is try to be guided by the objective analysis and data that's out there, but also some of the science that's out there. And that's really challenging. I don't know if colleagues are finding it particularly challenging as well, but we're being inundated almost on a regular basis by different papers, different guidance, some from the department, from the media, etc. Did anybody else spot the irony last night when 4 documents came past 7 o'clock and then one of them was related to work-life balance? You know, at times it does seem a little bit tenuous, some of the way that they're working on things. So our 4 tests. First of all, test 1. We think that the way that we've approached the idea of opening schools is a little bit flawed in the fact that it offers this idea that there's a blanket approach, schools should open at such a time. And what we've noticed, even in the northwest region, is we've got massive variability about the transference of the virus at this point in time. So we know that the R rate across the country is something between 0.6 and 0.9. And in Oldham particularly, it's just over 0.9. So the risk to our communities in Oldham at this point in time is still really, really high. And we are bothered that if we don't act in a very, very cautious way about the reopening of schools where children come to our sites, then actually that could cause a real spike within our communities. So our local colleagues that are in NHS have been really, really supportive. And on a weekly basis, we get an indication of where the R level is for our different areas. So Oldham is a particularly high risk area. We have about 35% of our communities from Pakistani, Bangladeshi backgrounds. We have quite high levels of deprivation. We have a number of indicators that suggest our communities are particularly susceptible to coronavirus, and therefore so are their children and so are their families. So some of our schools in Oldham are being a little bit more cautious than our schools that are in other areas within the northwest. So that's one test that we will look at on a weekly basis. Okay, does anybody want any comment about that at all?
Can I just ask, do you get that information directly from the NHS?
Yeah.
Okay.
So is it local areas will have that information? Now,
so we just go to maybe our local NHS and ask for it?
Yeah. Yeah. Now it's only one indicator, but over time it allows you to be able to track what's happening within your communities. So we feel it's an important indicator for our communities. Okay, the second test is that we need to be assured really around the staffing solution, and this is a massive piece of work. We've got a huge team looking at all of this across all of our schools. And we've sort of looked at our staff teams in 3 groups. We've got a group of staff that are shielding, and therefore, even though they may have been given a shielding letter maybe 7 or 8 weeks ago, we believe that they will get another letter to continue to allow them to shield, bearing in mind the R rate in our area is still very, very significant. We don't know that for certain, but that's an assumption that we're making. So we've got a group of staff that are shielding. We've got a group of staff that are probably like you guys have got as well, that are particularly keen and want to work in schools and are desperate to work with the children. And then we've got the biggest group that are in the middle. And they tend to be a group that some are social isolating. Some have family members that are particularly at risk, and those are our most significant group of staff. Now, I noticed there was a question that came through prior to today's webinar that talked about a specific, what do we do with a member of staff, etc., etc. And we don't really have the answer with that. We think that the middle group of staff will be the ones where there's going to be the most challenging conversations. Because there will be some there that are nearer the shielding end, and therefore it's clear that actually they can't work alongside children. They can't do face-to-face work with children, and what they will need to do is support the virtual work. But there will be other colleagues who are nearer. We desperately want to work, and actually it's probably safe for them to work. And I guess there's going to be a group in the middle where there's going to be some quite challenging conversations. Now, we don't expect there to be government guidance that relates to this group of staff. I think a number of us have looked for that, but we don't think it will be there. And I think what will be passed to us as employers is that we need to adhere to our own policies as to how we actually manage that group of staff. Now, clearly, we will have a view, as will the unions, as will the individuals. And it's going to be a particularly, I think that could be a particularly challenging time for our schools as we start to work out what the new schooling offer is going to start to look like, and what the staff solution will be for different parts of the new schooling offer. So that our test 2 looks at all of that and actually looks what individual schools, what staff teams they've got available to be able to work with children. Okay, I'll pause there before I move on to 3. Pauline, have you anything to add at all at the minute on that?
No, just, you know, that R factor, the rate of infection spreading, I think is really key, because certainly where I am in northeastern Yorkshire, they've just said on the TV that ours is up to 0.8. So it wouldn't take much to tip it over to the 1, which is what the government are trying to avoid. So I think that idea of looking at that locally, and for schools using that as one of the key indicators of how they can go, and reviewing it to see the impact of schools opening, I think is going to be very important. Also, just on the news there, they were saying that maybe they do need to look at different rates of unlocking in different areas of the country. So I think really they're coming to the conclusion that you and your team came to a few days ago. Yeah.
And again, colleagues, you know, it's just that extreme caution that we will, let's not be bullied into anything that leads to anything other than really a safe future for all of our children.
Graham,
okay,
can I just add?
Yeah.
The other thing is what Graham was saying about staff, and I think the key message there for me is transparency, and about that you are co-constructing all of this with your staff. And you know, people are going to be scared, and I think we've got to acknowledge that. Yeah. And people are going to be scared for themselves, their families, etc. And I think the more we can do that is transparent and involve them at every stage, I think the better and the more confident people are likely to be to return to school, knowing that you as leaders are doing the very, very best you can to mitigate against risk. You'll never alleviate it totally, but it's about how much can you mitigate again.
Do you mind if I chip in?
No, we'd love you to.
Thank you. And Helen from Chatsworth in Salford. We've been in conversations with the local authority at Salford, and they said that they would support us with those conversations with staff as providing some sort of overarching guidelines, as this is what the expectation is, which we found really helpful. Obviously, we're still going to have those conversations, but it's helpful that it's coming from a local authority background. It gives us just a bit more support from behind, really. And also we've got the support from our educational psychologists that have said they will support where necessary, and we're giving out a lot of wellbeing information in the meantime and trying to get staff to stay communicating with each other and with us, because otherwise I think the longer people are out of work, the harder it is for anybody to get back to some sort of normality, really.
Totally agree, Helen. Absolutely, yeah. And again, I think that the importance of working with our colleagues and ensuring that we're not being mavericks and just doing our own thing, you know, I certainly that's the position that we're trying to take. Even though we're trust, we're working very closely with all the local authority HR teams in the same way that you guys are working with Salford.
Yeah.
Okay. On to test 3. This is a challenging one for our little one, for our schools that support our children at primary age. We need to do some work around social distancing and planning around social distancing. I think in everything, and if people do want any of the detailed plans that go behind this, I've agreed with Pauline that we're happy to share them. So, you know, please feel free just to use them or not. But at this point in time, our building strategy around the risk assessments, bearing in mind it's only in consultation and draft form, it has got about 70 or 80 different points. One of my heads this morning said just that alone is going to take at least till September to try and work out the risk assessment. In our modern schools that are lovely and spacious, then actually working out the logistics isn't quite as tricky. In our schools where we've got very, very thin corridors, where the school hasn't been designed to be fit for purpose, the idea of social distancing is a real challenge. And then we've got the added complication of children who will, however we dress this up, just not understand social distancing, which is a significant proportion of our population's colleagues. And this is a real worry for us, to make sure that we really do all of that work now really quite carefully. I was having a conversation with my wife this morning about some of the things that you see on TV, where you've got children in playgrounds in mainstream schools studying in a hoop, not a hula hoop, you know, a little hoop or on a 2 meter square. And I'm just really, really concerned about what that's doing to those children's mental health and where that's taking them. So we've got a huge piece of work that's everything about all of our logistics. On the back of all of that is the transport issues as well. Again, the majority of our children, in the same way that yours, will be brought in by local authority buses and taxis. We've got a real concern about the age demographic of our school escorts and the number of those that are shielding. Therefore, that puts pressure on, if a child is coming to one of our sites and it's not with a familiar person, the pressure that puts on that individual. And so we're more than happy to share all of that work if people would find it useful. So that's our test 3, that we have to be really assured that all of our schools, all of our organisations do have strong social distancing procedures and practices in place that are as good as they possibly can be, bearing in mind the nature of the children that we've got. Any comments on test 3 at all?
I just quite agree. It is quite a worry with our cohort of children, isn't it? We're looking at a one-way system around school, and you know, because we have got narrow corridors and obviously limited numbers in classrooms, and we've had discussions with transport this week that said on one of the usual school buses they're going to only have 1 or 2 students because of social distancing. So it is it's a lot to think about, isn't it?
Really, I mean, the one that got me was fire drills.
Oh yeah.
Just the bits you've not even thought of. And you think, oh goodness gracious, we're good. You know, you're all in our fire drills. All the young people sort of gather in a group, but clearly they can't gather in a group now. They have to gather in sort of a group, but about 2 meters apart in a group. So, sort of gather over there, but not quite in a group. So that's going to be a challenge for all of our teams that are working on that. Okay, on to test 4. This has obviously changed last night following the guidance. I only picked up the guidance last night, particularly around children that tend to spit. So there is new guidance that's coming out around PPE. Again, our colleagues in our area in the health service have been brilliant. So they've provided. We took a very clear position around PPE very, very early on, particularly for the children that we provide intimate care for. And all of the staff team there have been provided with full PPE, including visors. Now, that's just our solution. I'm not in any way suggesting it should be our solution. The guidance is now there. It is a little bit contradictory in places, but I think in the next few days, hopefully, it will become a little bit clearer around PPE. We do want to be, again, we want to be assured that all of our schools will have the appropriate PPE. What became really apparent early on for us is it wasn't just having the PPE, but it was all the training that related to PPE as well. So our training and development teams are looking at what's required around training for PPE, so that, again, school leaders can be assured that we've got it available and it's been used appropriately for when it needs to be used. The worry that we have, I keep going on to worries and I shouldn't do, but I am doing slightly, is how it's affecting how children are presenting. So we're seeing the children that are in our schools who present in a very different way, last year, and now reverting back to certain behaviours because of their anxiety levels going through the roof, because they're now seeing staff dressed in a way that they've not seen before. So again, teams are looking at evaluating that and the impact that will have. And that's particularly, we have a free school for children who are on the continuum, whose primary need is ASC. And that's causing a significant challenge in that school. So usually children who engage with us particularly well and particularly positively are presenting in a very different way because of them being exposed to staff dressing in different ways and new clothes, etc., etc.
Graham,
Okay. Yeah.
can I interrupt?
Yeah, cool, absolutely.
There's a couple of questions coming through asking around where you got your PPE from and where you got your training from. And I also think you've just made about children seeing staff differently goes back to something you said very at the beginning around, are we educating or are we still childcare? Because the more pressures we're putting on the young people in terms of learning, the more of the behaviours we might see where staff may need to be in closer contact, etc.
Sure, absolutely, yeah, important point, Pauline. Yeah. Can I pick up all the PPE if we've got them on the chat, and I'm assuming that we can capture those. I'm happy to share our suppliers and what we've done with all of that outside this meeting. That's absolutely fine. So to be honest, our local authorities that we work with have been absolutely superb, albeit for a very, very small number of children. But we've been able to source all the PPE at no cost. So we've had it provided from the NHS and from I think some of it came from the primary care trusts as well. So yeah, we've done well with that. Okay, so then the last test relates to this issue of vulnerability and the groups of children that are going to actually come into our organisations. And I think it's fair to say, colleagues, that what we've noticed across the country is families being very, very confused around why their child has not been sent a shielding letter. Now, a number of colleagues have looked into that, and we believe that between about 15 and 20% of children who schools believe should have received a shielding letter, so it's children with very, very complex medical needs, haven't received them at all. And the latest guidance is actually that families now need to instigate the shielding letter through their GPs. Now, I don't know whether you feel the same, but that group of children with the most overlapping and most significant clinical needs are the biggest worry that we have within our schools. But also, obviously, it's a worry them not having that social interaction with our staff teams and with their peers as well. So again, we are being very, very cautious when it looks at the cohorts of children that we're going to admit back into our schools. But certainly at this point in time, with the R level being so high and some of the other factors not being robust enough around our testing, I think it will be quite a period of time until children with the most significant, complex and overlapping needs actually return to our school sites to be involved in schooling as it used to be in sort of January and February time. So that's one of our final tests that we're looking at. Okay, so I don't know if anybody's got any other observations about groups of children at all. Okay. Oh, Polly. Oh.
What? Hello?
Okay, so should we move on? No, Pauline, you're up.
Sorry?
I don't know. You've gone really big on my screen.
Oh, dear.
Graham,
Yeah.
Kevin Morgan, executive head teacher in Samwell. Just actually sort of on that, brilliant in terms of the tests, 1 to 5. But what I'm actually sort of seeing actually here is the students that are not going to be coming in. You know, as a parent myself, actually not getting the kids in. So what I'm saying is actually there's that other layer that we've got to prepare for, isn't it? And canvassing my students at the moment and parents, we're looking at about probably 60% are not going to send the students in at the moment. So it's strategies clearly with the remote learning, virtual learning, whatever we call it.
Yeah.
We've got to actually maintain that as well at the same time, haven't we?
Absolutely. And this is, do you remember when I spoke about the new schooling document early on?
Yep.
I think that what it's important to do is stress that really, and it goes back to that point that Pauline emphasised, the fact that actually there's so few children coming into the sites because of what the reasons that you've outlined. Actually, schooling in terms that families think is going to go on isn't likely to happen. So actually our virtual learning strategy, we're fortunate all our schools are one-to-one schools, so all of our children, all of our staff have iPads. So it's something that we've been part of the one-to-one strategy for the last 18 months or so. So our children are very used to learning in that way. So we've seen that very much as part of our overall new schooling offer. So I agree.
Yeah.
You know,
But there's another layer, Graham, as well, is the fact that this morning I've had email from a local authority group head that actually said out of the 4,000 students that actually have social workers, there are only going to be about 1,654 laptops coming in.
Yeah.
Well, I teach IT, and you know, to actually get images, software on those machines are not going to be ready till probably mid-June, July. So this is an extra layer in your new schooling phase actually on there that is actually quite significant, isn't it? So we've got 60% not in. We've probably got 10% that have actually got access to, you know, sort of Wi-Fi, laptops to enable to do actually high quality learning. And that's another factor I think that I've, you know, we tried to build in, but it is demanding, it is difficult.
Absolutely. Yeah. I absolutely see that. Absolutely see
Yep.
that. Okay. I mean, do you think you know what your solution will be for that?
Yeah, the solution is I've actually sort of sourced additional laptops. They're being imaged and sort of set up today. So therefore I've, you know, but it's a cost, isn't it? And like all of us, you know, we've got a limit of which we can claw back money from government. But at the same time, there is a limit. And if our reserves are higher than clearly zero, we have reserves, then clearly I can see that there could be a limit on what we can claim back for. It's just a bit of concern. You know, we've got parents that want to engage. We've got students living with grandparents. You know, a lot of grandparents are not tech savvy at all, are they? And we're having to help and support, putting some of my staff actually at going to do social distance home visits at risk as well, because we're trying to support, we're trying to get them online. And it is causing a few little issues actually as we go forward. But, you know, it's okay. You know, the Director of Education in Samwell have just launched a document out about 12 o'clock today. And again, it's that constant looking through guidance, isn't it? Checking, rechecking actually on there that we're trying to go forward. But it's this layer of actually, never mind opening, it's the layer of kids that are not going to come in, which I think is the key. So we've got platforms for online learning, online mentoring, online actually intervention going on as well. So there's my strategy really. Well, I've just tried to work on that. So.
Okay, great. Thank you. Okay, Mike, can we put up the sort of risk assessment process now? So you've sort of looked at we looked at the tests, and that's what we're doing. And then we're going to go through the process. And I'm not going to whiz through all of this, but I'll sort of give you an idea. We've got 16 steps in our process that we're exploring. And really, we're not doing any work around risk assessing the children until about step 5 or 6. Most of the work at this point in time, as I mentioned earlier, in the next certainly 10 days to a fortnight, we'll be just trying to co-produce the documents so that we're all on the same page with all of our key partners. And that's something that we are really, really keen to do. So 1 to sort of 6. Mike, is it possible to get that up on the screen?
That's just gone in now. Yep.
Yes, thank you.
Sorry, just waiting for Tom to present his screen.
Sorry, Tom. I think he's gone for a cup of coffee.
Sorry, which document is it that you want, Graham? The
one with the arrows on, Tom, please.
The arrows, yeah. Okay, yeah. Great.
Kevin was mentioning about this is my lack of skills of being able to do anything. Thank you. Thanks, Tom. Okay, so this is sort of our timeline. We had a long debate this morning of whether this should actually be linked to specific dates, and we've agreed not. For one of the reasons that I said earlier, that actually some schools it will take, they will be able to get to stage 6 and 7 earlier than others, and that's absolutely fine. So if schools can work at their own pace, and our trustees are very, very supportive of that. So again, I'm more than happy to share all of this. All of this has an awful lot of information behind it all. But basically, if we're going to look to about 1 to 5, 1 to 6, is where we actually start to consult upon processes. When we start to get to 5 and 6 and 7, we're talking about the young people themselves and doing risk assessments with them, with their families and with our staff teams. We're doing risk assessments on our staff and checking whether we've got staffing solutions to meet the needs. And then the other bit is around the logistics again, which I spoke about around our schools and one thing and another. So I think it's reasonably straightforward. But a couple of bits that I want to sort of pick out there are what we've tried to do is that within our cunning plan, we would obviously hope that we get to a position that we agree with our families that it's in the best interest of everybody that their child is involved in that part of the new schooling offer. Clearly, there will be some challenges to that, and we, I guess, like you guys, at times we're put under a little bit of pressure around admitting certain children and the like who actually we don't think it's necessarily the right solution for. So what we've done is we've built in sort of an appeals process. So there will be a group of people that actually make the decision that includes the family and the young person. If we can't get an agreement at that stage, then we do have an appeals process that my trustees sit independently outside of that is able to sort of objectively look at all of the risk assessments that are available and then able to either agree or not agree as to what provision around new schooling has been offered to each of the children. So we felt that was really, really important so that families feel that, again, they're up front and centre in making the decision, and hopefully, you know, we will guide them in the best way that we possibly can do, of which some of it will be that they need to move back onto sites, children will be back on sites, others it will be more virtual, others might be part-time, dropping in and out of different models as long as we can staff that and as long as the logistics support that as well, things like transport and the building itself. But if we are in dispute with certain individuals, we do have a mechanism of actually ensuring that there's an arbiter of all of that outside that. So again, as I've said, I'm more than happy to share any of that, and each of the different sort of arrows has a risk assessment or a process attached to it that again our team are happy to share with you guys on any of that. Now you'll be, as we have been, absolutely inundated with risk assessments, so probably the ones that you're using are exactly the same as this, and we don't want anybody to sort of feel that they've got to use a certain model or another. But I know that quite a number of schools that we've worked with said having something and being able to compare and contrast has been really, really useful. We used the premises one from a school in Kent who've done a really, really robust risk assessment around their premises. So they've agreed that we can share theirs. So I'm sure that in the spirit of collaboration, colleagues, that you know, I'm more than happy to share this. And you guys, I'm sure collectively we can share something to get it right for the children. Okay, so I'm going to pause again. Has anybody got any particular questions on any of that? Okay. I think from a sort of where we're up to process, that's as far as I can go without wittering on even more, because we're sort of amending and changing and modifying and adapting all the documents as live documents, because that's what they are. If you guys want any of them and want to feed into them, we'd love that. Getting outside support will be really, really useful for us as well. So that when we get to the stage of actually rolling out in about 10 days, 14 days, then at least we'll be position where it's gone through several iterations to get to a document that's reasonably high quality. So I think that's it from sort of tests and where we're up to. Have we got any specific questions, Pauline, that people want to ask or share, or where anything that people want? So
I think, Graham, the questions that came in prior to the meeting, I think you have answered, because there was one around staffing and who are declaring themselves not able to come back to work, etc. So I think you've already said that middle group, if you like, are going to be the hardest, and it's about working with them and their GP or whatever in that respect. The other one was about a young person who is lots of saliva smearing, and there was a concern about no amount of cleaning might make it safe. But again, I think it's going back to that very detailed risk assessment is the answer to that, and for the school to come up with that jointly. And then there was one around, again, it was around risk assessments, and I think you've covered all of that as well. So, I mean, all I would like to reiterate in a sense to everybody is if you've got similar documents or something different or something, you know, that is working for you, please share it. I mean, if you email it to me and you're willing to share it, we can put it on the forum. We can attach it to this webinar, which has been recorded and will be available online if you want other staff to see it, or colleagues who haven't been able to join us today. So, you know, in the spirit of sharing, we're in this together. It's new for everybody. So, you know, no matter how simple an idea, it could be just something, that seed of an idea for somebody else says, that's what I've been looking for. That's given me the answer that I just couldn't see for myself. And I know Graham and I this morning were talking about, at the moment, everything seems to be just coming down on you and you're inundated with paperwork, do this, do that, and do the other. And then another piece of paperwork comes in and you've got to change it. But at times, and I know it's going to be really difficult, but perhaps to be able to step back and say, what are we doing now that's working? What can we take forward into what is going to be the new norm? And I think there are things we can take forward. I'm just looking. One of our colleagues that was on slightly earlier, he was, I had a conversation with him, and he was saying that all of this online stuff has actually re-engaged many parents who weren't engaged before. So he's certainly going to take that forward. And I know, Graham, you had something with some of your SEMH students that you're going to think about how you can integrate that into the new norm for them, aren't you?
More work in lockdown than we ever do when we're open.
Yeah, because they can choose when they work.
Absolutely, choose when they want to do it.
Big thing.
Yeah.
So it's about giving yourselves a bit of time, because I know it's difficult, but I think there is quite a lot to be learnt. And I know that we've shared the link again about Barry Carpenter's The Recovery Curriculum. And I think it is really timely to start thinking, when the children are coming back, what is going to be important? You know, yes, you know, for some children, rightly so, you know, academia is the way forward, but for lots of others, we've got to look after their mental health and well-being. And until we get children who are feeling safe and secure, then learning isn't going to take place, is it? So, you know, it's what is going to be important when children come back. I think there's quite a lot of discussions to have around those.
Okay. Thanks.
Graham, is it possible to just a question about spring bank holiday? What you're actually sort of doing there. Will you be open over those time? And have you had any pressure applied to be open on bank holidays as well?
yes, in relation to Spring Bank holiday, we've stayed open right the way through now.
Yep.
The rotas, we've ensured that the rotas for the staff that are in that group that are over here,
Yep.
that are working, we've ensured that they're getting at least 3, hopefully 4 days off per week, every week. That's including the weekends. So they're getting a couple of days in the week as well, to ensure that they're, they don't burn out, etc. So we've managed to stay open right the way through. Our schools operate for 48 weeks a year anyhow, so we run holiday clubs right the way through. So there's always been an emphasis that we've been able to stay open. The virtual learning stops at that point in time. So at this point in time, around holidays and bank holidays, the only part that's still operational is the bit that's open for the children from key workers and the vulnerable children. So it's a very, very small number. In our context, it's about 40 children across all of our schools. So it's very, very few. Now, you'll have seen the same media coverage that I've seen in relation to the Spring Bank holiday and the summer holidays as well. I don't know any more than you guys do about any of that. I think there will be a group of organisations that expect us to continue to stay open. Again, an individual level will have to risk assess all of that and be very, very careful. From a personal perspective, and I don't know if you guys feel the same, I think I've never worked as hard. Just at times, my head feels like it's going to explode in the fact that just the information that's coming in is at times, really quite stressful. And, I think we do need to ensure that at times we also get a break as well. But there's a growing momentum to suggest that we need to look at what's happening at spring half term in the summer. Obviously, the unions, all of our unions and professional associations have a very, very different view of that.
Yep, thank you.
Graham?
Yeah.
One colleague has asked whether social distancing risk assessment could be shared as well.
Definitely, yeah. Yeah. It's in test. I think it's in test 3 or 4.
Yeah.
So yeah, there's no problem at all. I mean, what I'll do is upload everything probably over the weekend, Paul. It may not be today. I don't know whether our tech teams are working today, but it'll certainly be available for Monday, and people can just pull down whatever they choose to do on that.
Thank you.
There's no problem at all with that.
There is just one final question as well, Graham, if that's okay, which is, have you experienced any issues with families when you've been identifying them as socially vulnerable and suggesting that their children may be safer in school? Yeah,
really good question. We have, and it's been particularly from our one of our primary SMH schools, where at times it can be a little bit strained, the relationship with some of the families. Just to put the context there, the children who probably struggled at times in mainstream primary schools for one reason or another, and they end up coming to us, and at times families aren't over keen about our provision. And what we've tried to do there, one of the reasons that we're spending an awful lot of time on this front end of the new schooling is to engage with our social work colleagues and our youth worker colleagues and our family support worker colleagues, so that we're not just exposing it to being a school-based solution, i.e. your child is better in school because that teacher or that support staff or that pastoral member of staff is saying so. Actually, there's a team of people who are actually having the same conversation with you. So that's why we want to really do that robust piece of work now and up front, so that we're not exposing our colleagues to have those really, really tricky conversations on their own in 2-3 weeks' time. Does that answer your question?
I'll wait to see if there's a response. Yes, that's from Sue, so thank you.
Thank you. Any other questions, Mike? Actually, there's a question here from Helen saying she's had quite the opposite response, where parents are asking why their children haven't been told they should come to school. Helen, do you want to come in on that and talk a bit more about that? Can I unmute you?
Yeah, sorry, I feel like I'm hogging this. I'm on every other minute. We've had some parents ringing in saying, why isn't my child in? Or we review it regularly, so the priority list changes.
Yeah.
And if children have been coming in and then they're not, some parents have been really quite angry with us as to, well, why can't my child come in? Do you not see them as a priority? And that's been quite difficult to manage, because obviously we're doing the best we can. We'd love to have them all in, but we've got to look after staff and other students. So that's probably been more, nobody's asked why their children have been selected to come in, but a number have been saying, why can't you have my child in?
Yeah.
Don't know if anyone else said that.
Any other responses to that? Some people are nodding, Helen. Yeah.
That's good. I'm not on my own.
Any other questions? No. Well, in that case, I'm going to say an absolutely huge thank you, Graham, for your time this afternoon, and to all of you as well for joining us. And Pauline, I think it's been really helpful, hasn't it? Just to clarify some of those topics that we know are a key concern for the network.
I think it certainly has been useful just to hear you and see you, and obviously we'll make sure that all the documentation that Graham sends through on Monday is put in one place for you to access it, and hopefully, because I can't do it from home, but Mike or Tom will be able to do it, I hope, and I'll be able to update you as to where you can access it from in the daily update on Monday evening or Tuesday at the latest. Okay, so please bear with me.
Brilliant. Thank you, Pauline, and thank you again to Graham. I'm sure all of you on this call are already subscribed to the SSAT SEND email forum, which Pauline facilitates and is sending daily updates. But please do make sure that all of your staff are on there. If they're not, then you can email your relationship manager at rmteam@ssatuk.co.uk. Just before we finish, we have one, I think, final question or comment from Eileen, who's got her hand up. So, Eileen, do you want to come in? You're unmuted.
Hi, everyone. I just want to say huge thanks to Pauline, because the information we've got through this period from the SSAT has been among the best stuff I've received as a London school, and it's really helped me to make good decisions. And she sent emails at all times of the day and night, which we can read as and when, but I, for one, am very grateful. So thank you, Pauline.
You're welcome.
Thank you. Yeah, thank you, Eileen, and thank you, Pauline. There are lots of nodding heads to that. So thank you. And really, just to finish, we know there's difficult times, but as Graham said, we know you're working round the clock at the moment. So thank you to all of you. I think the media this week has not been particularly kind to teachers, but we love you. We really value the work you do. And so please try and find some time this weekend for yourselves and to have that break that is so sorely needed, and try to have a glorious weekend. But please do be in touch. Let us know about how Pauline and the team can help you at SSAT. Thank you. Have a good evening and a good weekend.